Hello, I will be presenting a project that we did called C1 Online, Do One, Teach One, YouTube as a learning resource for surgeons. Introduction. Seeing an operation has long been recognized as the first step towards learning a procedure. Once limited to the operating room, visual learning has become increasingly accessible to the contemporary surgical trainee due to online surgical content. YouTube is the most common platform leveraged by practicing surgeons and trainees. To better assess the unmet content needs, we sought to determine the number of videos available relative to the search frequency for specific general surgical operations. So we identified 28 laparoscopic and robotic general surgical procedures on YouTube. Searches were filtered by most views, most relevant, and highest rated. The top 5 search results in each of those categories were analyzed for characteristics including views, runtime, date added, and video engagement, including comments and likes. We used a search on Google by typing in site:/youtube.com to identify the number of surgical videos that were available per procedure or operation. And we used a platform called vidIQ to determine the number of searches that were being performed for each of those operations per month. For the results, for each operation, YouTube searches per month were plotted against a YouTube video, the YouTube videos available. For 6 out of 28, or 21.4% of the procedures, the videos available matched the number of searches per month, as seen along the line. For 13 out of 28 of those procedures, or 46.4%, the number of videos outweighed the number of searches, so indicating that there were more videos available than people searching for those videos. And for 9 out of 28, or 32.2%, there were fewer videos available relative to the searches, indicating that there was potentially an unmet need in this category. Those searches and unmet needs are plotted along the line on the chart below. For each operation was further filtered by most views, most relevant, and highest rated, and the top 5 videos in each category were further evaluated for video title, author, journal or sponsoring institution where it was applicable, number of views, video length and runtime, post date, and engagement, including comments and likes. An example of these collected data for laparoscopic left hemicolectomy is seen in our results section on the bottom. So in conclusion, YouTube is highly utilized and broadly accessible learning resource for surgeons. In the majority of cases, there is an imbalance between the content availability defined by the number of YouTube videos available on a particular operation and the need, as evidenced by the number of searches performed per month. In our present study, we identified 9 cases where additional content may satisfy a currently unmet need. Further content generation should be created in areas with high monthly searches and low numbers of surgical videos. For future directions, future analysis will address video quality, both in terms of the production, so image, sound, etc., and the quality of the actual content, so the surgical quality, accuracy of the description or the technique, and how this may differ when filtering for most views, most relevant, and highest rated result categories. Additional work can also be done to evaluate user satisfaction with the available content to better address educational and performance improvement needs. Thank you for coming to my e-poster.